Hello, I'm Dr. Robert Pollard. This videotape is an accompaniment to the workbook entitled Mental Health Interpreting, a Mentored Curriculum. This curriculum was developed as an aid to foreign language interpreters who find themselves working in the challenging world of mental health services. It is meant to be used in a one-to-one learning relationship with an experienced mental health interpreting mentor. The information we are presenting is an outgrowth of our work with sign language interpreters. Over the years, we've learned a great deal about what information any interpreter needs to know to work more effectively with mental health professionals and their patients. A dedicated team of interpreters and clinicians cooperated in this exciting educational venture. It was sponsored by the Monroe County Office of Mental Health in Rochester, New York, and the Department of Psychiatry at the University of Rochester Medical Center. We are pleased to present this innovative videotape and workbook for the educational benefit of interpreters everywhere. Your feedback about our curriculum is most welcomed. Thank you, and good luck in your important work. In this first vignette, we see an interpreter and a clinician meeting for the first time. In this helpful pre-session, the interpreter learns about the purpose and nature of the upcoming clinical interview. This allows her to better prepare for and anticipate the specific interpreting work she'll have to do. The clinician likewise has an opportunity to learn important specifics about how professional interpreters do their work.
Hi, I'm Patricia. I'm the interpreter that's going to be working this session today.
Hi, Patricia. It's nice to meet you.
Nice to meet you.
I'm glad that you came by. I was hoping maybe we could talk a little bit.
Okay. I usually like to have a pre-session so I'm better able to prepare for a session. I'd like to know a little bit about what we're going to be talking about.
Oh, absolutely. We had National Depression Screening Day last week, and we received a referral on a 50-year-old woman who just recently lost her spouse. So some of the things that I'm going to be going over today with her will be an assessment of her symptoms, her physical and mental history, and also a mental status exam.
Okay. All right. Have you ever worked with an interpreter before?
No, I haven't.
Okay. When we meet with a patient, you can address the patient directly. You can speak to her and look at her directly. Okay. I'll be doing the interpretation in first person unless it seems that the patient is having a hard time with that. At that point, I might switch to third person. It fosters a better relationship between you and the patient.
Okay. Is there anything else that you can tell me that will help make the session go more smoothly?
Probably to inspire more trust. I guess I describe it as warm etiquette. Okay. When you first meet the patient, you can state your title, your name, do your greeting, and then we can tell the patient where we'll be having the session.
Okay. Well, this has been very helpful for me. I'm glad that you came by.
Great, great. I find these to be very useful also. We usually like to have them sessions pre or post session. That way we can talk a little bit. It helps for better communication, cultural issues that might come up, and linguistic issues that might come up can also be discussed during those sessions.
Well, I look forward to having some more time to speak with you in the
Likewise,
future.
Yes.
In this vignette, we see a Russian language interpreter working with a mental health clinician and a recent immigrant from the Ukraine. Sometimes, the special relationship that foreign language speaking patients feel toward the interpreter leads them to make private comments to the interpreter that they don't want translated. This disrupts the interpreter's work and challenges the boundaries of their professional role. Watch how this interpreter handles that type of situation.
So, Mrs. Melnick, how old are you?
Mrs. Melnick, сколько вам лет?
48.
She's 48 years old.
And where do you live?
Где вы живете?
Я живу в Рочестере.
She lives in Rochester.
And what is your place of origin? I mean, where are you originally from?
Откуда вы родом, где вы родились?
Родилась в России, в Киеве.
She was born in Russia, in Kiev. Now it's Ukraine.
Oh, I see. And do you have any brothers and sisters here?
Есть ли у вас здесь братья и сестры?
У меня 2 сестры, но какая разница?
She has 2 sisters. See, that's what makes a difference? Why are you asking all these questions?
Oh, Mrs. Melnick, all this information is important to us because it might help us understand your state of mind better, okay? Were you hospitalized ever before this too?
Знаете, это необходимо, эта информация необходима доктору для того, чтобы знать о вас больше. Были ли вы госпитализированы?
Я не понимаю, почему он меня это спрашивает. Он спрашивает всех американцев эти вопросы.
I'm sorry, I think I need a minute. The patient is trying to have a private conversation with me. Let me explain my role. Is that okay?
Yeah, sure, please.
Знаете, необходимо ему знать больше информации о вас, для того, чтобы правильно поставить диагноз и правильное лечение подобрать. И они не делают разницы ни для американцев, ни для тех, кто приехал. Все пациенты одинаково совершенно для доктора. Ему нужны эти ответы для того, чтобы принять правильное решение. Что касается меня, я должен переводить все, что вы говорите, доктору. И, соответственно, все, что говорит доктор, я перевожу вам.
American concepts of mental illness often differ from those in other countries. In the first part of this 2-part vignette, a Vietnamese language interpreter encounters vastly different attitudes toward mental illness between a doctor and the mother of a young woman. Thank you for coming, Mrs. Nguyen. As you know, your daughter had a serious suicide attempt last night. She's doing better now, but I need to talk to you about your helping us in the treatment planning process.
Chị Nguyễn cảm ơn chị hôm nay tới đây gặp tôi. Chị đã biết là con chị tối hôm qua có tự tử á. Thành ra tụi tôi hôm nay cần phải nói chuyện với chị để có một cái kế hoạch để giúp cho con chị.
Tôi không tin con tôi bệnh. Tại vì tối hôm qua nó còn đi học về. Đâu có gì đâu. Mà tại sao nó bệnh?
I do not believe my daughter tried to commit suicide, and I do not believe my daughter was sick. She was fine last night.
Mrs. Nguyen, I had a visit with your daughter this morning, and we talked about how much she wants to kill herself. Now, this is serious, and she needs to stay with us probably for about a week, and then she will be better and can go home.
Chị Nguyễn sáng nay tôi có nói chuyện với con chị. Con chị có nói cho tôi biết là nó có thử. Với cái chuyện này rất là quan trọng. Chị cần phải cho nó ở lại đây một tuần. Có thể sau để cho con chị đi về được.
Tôi không tin nó tự tử. Tôi muốn con tôi về nhà ngay hôm nay. Bởi vì ở đây làm cho con tôi nó còn càng thêm bệnh nhiều hơn nữa. Tôi không tin nó là có bệnh đó.
I do not believe that. As I said, I want my daughter to go home right now. And I think that if the longer she stay here, she will get worse.
I can't discharge your daughter now. It is not safe. And we will not make your daughter worse, Mrs. Nguyen. We're here to treat her. We're here to help her. Now, she will be better, but if you really want to help your daughter, you need to cooperate with us. And the first thing we need is for you to attend a treatment planning meeting with me, the psychologist, the social worker, and the counselor from school.
Chị Nguyễn tôi chắc chắn với chị là con chị cần phải hợp tác với tụi tôi, chị cần phải giúp tụi tôi để cho con chị có thể trở lại tốt. Nếu mà tôi đã đề nghị một cái cuộc họp rồi, ngày mai chị có thể gặp họp để gặp với bà giáo sư không, để gặp với tôi với một cái cố vấn trong nhà thương, với một cố vấn trong nhà trường để đề nghị để giúp cho con chị. Chị thấy thế nào?
Tôi thấy cuộc họp này tôi không muốn dự. Bởi vì con tôi đâu có bệnh đâu. Mà tôi không muốn người ta biết được chuyện gia đình của tôi, riêng gia đình tôi hết. Mà với con tôi nữa.
I cannot attend this meeting at all because this is my family matter and no one should know about it. And this is, no one should know. Doctor, is it possible that I can have a post-session with you later so we can discuss more about the cultural difference?
Sure. Did you notice how the interpreter in the last scene asked the doctor to have a post-session? This is an excellent way to ensure that you have the opportunity to discuss important language and cultural information with clinicians. Here, we join the interpreter and the doctor in that post-session. What was going on in there? I've never seen such an uncooperative individual in my life.
Oh, doctor, you need to understand one thing. That she was so resistant in that session was because there was some cultural difference in here. And let me tell you why. First of all, because you told her that her daughter is trying to commit suicide. And to that culture, that's unacceptable. Because if her daughter really does try to commit suicide, you're not supposed to know about it. Because this is a family matter. And usually the mental health issue is very secret in their family. And they don't like to share with anybody, any stranger. If they have that problem, they will share with a Buddhist monk, a priest, or, and that's it. And their relative, and nobody else. And besides, I am the interpreter, and I'm trying to interpret for you. And then she doesn't trust me well enough, and she thinks that I will bring her matter out to talk to the community.
But you're a professional. You have to be confidential with the things you hear in a session. Doesn't she understand that, a professional interpreter?
To her. To me, I know that my job is. I know that. But to her, she doesn't understand that interpreters are not supposed to share anything outside of the session. We know that. But to a person, a common person, she doesn't know that. A patient, they don't know that. They think that I will, because especially when we have a so small community in this Rochester, we know each other.
Well, it doesn't sound like it's going to be very easy to try to bridge this cultural gap, but I need to help her daughter. We need to help her daughter, and she's going to have to help us and cooperate in some way. I don't know what to do.
I tell you what, I have an article. It was really helpful to me one time and to the other doctor. I will send it to you. It might help you. And then I also know a psychologist who work with this population and have a lot of knowledge about this population.
That would be great.
So you might want to talk to him.
Great, great. I will contact that person right away, and I would appreciate any articles that you have on these cultural issues in mental health. Thank you.
Oh, I'd be glad to do that.
Believe it or not, mental health clinicians are often nervous or hesitant about working with patients who do not speak English. It's not unusual for clinicians to ask for information or help from the interpreter that is not appropriate to the interpreter's role. In this vignette, a Russian language interpreter experiences some of that pressure and handles it well.
Before you leave, can I ask you for a few minutes of your time?
Yeah, sure.
Thank you. First of all, I wanted to say that the session I thought went really, really well today.
Thank you.
And I thought that you did a great job. I did want to ask your opinion about something, however, if you don't mind.
That's fine.
Okay. I am leaning towards thinking about prescribing an antipsychotic medication for the patient, and I would like to know if you think that would be a good idea.
Oh, I'm sorry, doctor. I cannot help you with making medical decision. As for culture and language, then I can help you. And the language went fine, so she had normal Russian language. Whatever she was speaking was quite understandable in Russian. Mm-hmm. And when I was translating, she understood everything, so everything in terms of language went not normal. But for the medical decision, I'm sorry, I can't help.
Okay, I understand. I do have a question about culture, however. Do you think that she was acting paranoid compared to what's normal in Russia?
Oh, as for paranoia, how do I know? I'm not a doctor, I'm sorry.
Okay, but what about her expression of fear relating to her driver's license? What was that all about?
Oh, driver license, that's normal. The fear would
It
be
is.
normal because in Russia, the mental health patients, they're not supposed to have driver license.
Hmm.
And if they do have it before they become the mental health patient, the driver license would have been suspended right away.
Okay, that's understandable then. Thank you very much.
Welcome.
Interpreters often work with a relatively small community of individuals who speak a particular language. It is common for interpreters to be familiar with the individuals they are interpreting for, perhaps from previous interpreting assignments or because they know the individuals personally. While it is possible to do high-quality interpreting work for persons you've met before, it can present some difficult personal and ethical challenges. In this scene, an interpreter discusses some of these challenges with her supervisor, who is also an interpreter.
I had the worst meeting I think I have ever had. I had a session today with a patient that I know. I've known the family for a long time. I know the patient. I've interpreted for this patient in court, in medical settings here, in the emergency room. We had a session today. They were lying. They were withholding information.
Okay, so this was the very first session, the intake session?
Yes, it was
Okay.
the first time that we've met,
And you know...
that the therapist and the patient have met.
Okay. That sounds so common. And that happens very often with interpreters. It's a very small community.
Really?
And it may be the case that you interpret for patients here who you see out in the community, and you have a lot of information about them. But you know, Patricia, patients can and do withhold information from their therapists. And sometimes they can even lie in the session. And that is something that the therapist and the patient work on in their own relationship as it evolves. Those kinds of things will come out. But it's not our place to tell them the things that are missing.
You know, but it just felt like I should have pulled the clinician over to the side. We were wasting so much time. I mean, what if he makes a wrong diagnosis? You know, I wanted to just tell them everything I knew.
I'm sure that would have felt really good to do that. But you know what? Let's think about this for a minute. What if you did that? What if you told the clinician everything you knew about this patient? Tell me how that would have affected confidentiality and how it would affect the role of the interpreter.
I would have broken confidentiality with the patient, yeah.
And you need to think about that and how important that is, and it's central to our work, that we maintain confidentiality. Suppose that that patient realizes in the next session that that the clinician has information that he didn't give the clinician, and he suspects it's from you. He'll go back into the community and say that interpreter did not keep confidentiality, and there
Right.
you need to think about your career as well.
But what about if it's what if I run into the patient in the hall and they say to me that they're suicidal, that they're thinking of killing themselves?
Okay, now that to me is a little bit different. We need to distinguish between general information and a life-threatening situation. And that's one reason why I would hope that you try not to put yourself in a situation where you're alone with the patient. But if it does happen and they do divulge that type of information, it would be important, I think, for you to then say to the patient, listen, this is something that I feel needs to be told to the clinician. Suggest that they tell the clinician themselves in the session, or let them know that you will have to do that.
Okay.
This vignette shows another helpful pre-session between an interpreter and a clinician. In this scene, the interpreter's questions about the nature of the upcoming session lead to an important discussion about gender, age, and cultural issues that turn out to be very helpful to the clinician preparing for the session.
Thanks for coming in to interpret and help me out with this family in the waiting room. I appreciate it.
Karen, how may I help you today?
This family, I'll be doing a initial diagnosis of a girl who's been pulling her hair out, hearing voices, that type of thing. So it'll be the preliminary session.
So who out there waiting in the waiting room right now for the session?
Who's out there is a teenage girl, her mom, and their grandfather. Why do you ask?
Because the reason I ask, because the grandfather out there, I may have a problem with the grandfather to cooperate and give an information for the session because I'm a younger interpreter and he older.
Alrighty, because you're younger, you think there might be some issues. I'll try to help you out in that because as the clinician, I'll be the one doing the assessment and diagnosis, and hopefully I can get that cooperation. Does that sound okay?
Well, maybe you will get into difficulty with the grandfather too because you are a woman doctor and he is a man and older. So you may have problem with grandfather to cooperate with the session.
So, we have who's older, who's younger, who's male, who's female. Do you have any particular advice for me so we can walk in there and do the best we can to help this family out?
Well, I may have some advice to help you with that. When you walk out to the waiting room to greet them, would you use your first name? Don't look on the grandfather eye when you're talking to him, and lower your tone of voice to show him a respect. He might cooperate with you.
So try a friendlier type of style and not looking directly at him, avoiding eye contact if I can, and lower my voice as I address the grandfather. You think that would help out?
And then also your first name?
And try using my first name to gain cooperation.
Yeah.
I thank you for that advice. Yeah, we'll give it a try the best way we can help the family. Thanks. I appreciate it.
I'm glad to help.
In this vignette, we join a mental status exam in progress. The mental status exam is a common interview procedure in mental health settings. Here, the interpreter identifies both language and cultural factors that the clinician needs to understand if he's going to accomplish his task. The interpreter provides helpful guidance that allows the clinician to do his job more effectively. And do you remember the name of this clinic?
¿Se acuerda el nombre de esta clínica?
Esta clínica se llama St. Joseph's.
This clinic is called St. Joseph's.
Very good.
Muy bien.
I'd like you to spell the word world backwards.
Un momentico. Did you want the word in English or in Spanish? World or mundo?
Spanish, please.
Okay. Le estaba preguntando si quería la palabra en inglés o en español. Por favor, deletree la palabra mundo al revés.
O-D-N-U-M.
That's correct. O-D-N-U-M.
Please tell me what this saying means. You can't make a silk purse from a sow's ear.
Un momento, por favor. Bob, that saying doesn't translate too well into Spanish.
Couldn't we just pick the Spanish words that are the equivalent?
Yeah, but it wouldn't give it the same meaning. Perhaps what I can do is I'll give you a similar saying in Spanish. It would go something like, a monkey dressed in a silk suit is still a monkey.
Very good. Please do that.
Okay.
Thank you.
Perdón, él estaba indicando a él que el dicho que él quiere que usted le diga el significado, si lo traduzco literalmente, no da el mismo significado en español. Entonces, yo le voy a dar un dicho que tenga un significado parecido. Mona vestida de seda, mona se queda. ¿Sabe el significado de este dicho?
Esto quiere decir que una persona no puede cambiar su carácter simplemente con la apariencia.
This saying means that a person cannot change their inner character just by changing their outer appearance.
Very good. Thank you.
Muy bien, gracias.
One of the most difficult situations interpreters encounter is when a patient's thinking or language is seriously disturbed by their mental illness. This can happen when the illness affects certain brain functions. It's an event that is commonly seen in the emergency room, in inpatient settings, and occasionally in outpatient settings. But unless they work in the mental health field, most people have never seen this kind of thinking and language disturbance. It takes special skills to interpret for this type of patient in a way that is helpful to clinicians. This vignette has two parts. In the first part, the Spanish language interpreter is startled and confused by the patient's disturbed thinking and communication. Although her difficulty in translating the patient's speech is understandable, the interpreter reacts in a way that is not helpful to the clinician.
Calloso porque soy aquí.
I'm
Viva, está
crazy,
viva.
I don't
Hay
know why
brazos
I'm
en la
here.
computadora, colgando las ánimas colgando el árbol. Hay un árbol ahí que podemos.
Oh my.
Cuando yo era chica, yo nadaba
What's
con
she
los
saying?
pescados. Yo nadaba con los pescados. Yo no me quiero sentar aquí.
This is
esta silla
very
me gusta.
difficult.
Se va a caer ese archivo. El archivo se va a caer. Jesucristo era un revolucionario. Era revolucionario.
It's very.
Comunista. Era comunista.
She's talking about everything.
Lo mataron.
Just-
Lo mataron porque él quería
I'm sorry,
compartir-
I don't think I
compartir con
can
las
translate
personas. Y yo
this.
quiero compartir y no me quieren.
No.
While the situation in that last scene certainly presented a challenge to the interpreter, she was unable to find a way to be helpful. The clinician was aware that the patient was speaking a great deal, but heard almost no translation. He was left with very little information about the patient's disturbed ideas and language, and he could not do his job. But when a patient's language and thinking is so disturbed, how do you interpret that? It isn't easy. Watch again. In this next scene, the interpreter uses a more flexible interpreting approach that works much better.
Estoy loca. Yo no estoy
I'm
loca.
not crazy.
Viva, está viva, la computadora está
The
viva.
computer is
Hay brazos, hay
alive.
brazos, hay brazos. Hay ánimas colgando ahí, ánimas colgando en el árbol. No quiero estar aquí, no quiero estar. Cuando yo era chica, yo nadaba.
What's happening?
Her language is very unusual. It's difficult to translate. Let me describe it for you.
Please.
She's talking about the computer. It's got arms. Something about the trees. She's talking about swimming with fish, but the word that she uses for fish is prepared fish. Her speech is very rapid. She's not really logical. It's kind of hard to follow.
Mental health work often involves interpreting for people who feel very strong emotions and who may not behave in ways that we may expect or want them to. Clinicians know this, and it's an important part of their work to experience the emotions and behavior of the patient directly. Some interpreters find this challenge easy to work with, but others do not. In this two-part vignette, we see two different approaches to interpreting for a very angry patient who speaks Spanish. In this first scene, the interpreter translates the words and emotions of the patient into English accurately and as forcefully as the patient means them.
¿Por qué yo estoy aquí? ¿Por qué? Dime por qué yo estoy aquí. Yo me quiero ir ya. Si tú no me dices por qué yo estoy aquí, yo me voy a ir. Avanza y dime.
I want to leave now. If you don't tell me why I'm here, I want to leave now. Hurry up.
I understand that the wait is really hard, but we have to wait just a little bit longer. I need to get signed off by a supervisor.
Yo sé que la demora es larga, pero espera un poquito porque tengo que hablar con mi supervisor, perdón.
¿Pero de qué ella está hablando? Me hará yo perder... ¿Tú no eres una doctora? ¿Qué tú estás haciendo aquí hablándome? ¿Pero qué mierda es esta?
What? Lightning strike you down. I mean, what is she talking about? Aren't you a doctor? What kind of shit is this?
Actually, I'm a psychology intern. I'm not a doctor.
Soy una internista. Estoy estudiando. No soy doctora.
Pues vete, soy cante estúpida. Vete y tráeme un doctor para que yo me pueda ir. Avanza, avanzando.
Well, that's it. I mean, stupid. Just get out of here. If you're not a doctor, just go. Just hurry up. Come on. Get things going.
Would you be comfortable doing what the interpreter did in that last scene? If so, that's fine. It's helpful to the clinician. But there is another way to translate if you are not as comfortable with such strong emotions and behavior. Here's another version of the same scene. This time, the interpreter describes the patient's language and emotions. Though not as clear as a direct translation, this method of interpreting still gives the clinician the important information about the patient's communication and emotions that is needed.
¿Por qué yo estoy aquí? ¿Por qué tú me tienes aquí? Avanza, porque yo me quiero ir ya. Si tú no avanzas, yo me voy a ir ahora.
Hurry up. If you don't hurry up, I'm going to be leaving.
I understand that the wait is hard, but we have to wait just a little bit longer because I need to get signed off by a supervisor.
Espera un ratito. Yo sé que la demora es larga, pero tengo que hablar con mi supervisor primero.
Me arrayó palta, pero supervisor. ¿Y tú qué eres? ¿Tú no eres una doctora? ¿Pero por qué tú estás aquí hablándome? Avanza, yo me quiero ir, se canto estúpida. ¿Qué mierda es esta?
She's being very disrespectful. She's sworn at you a couple of times. Basically, she would like to leave right now.